My name is Blessing Omakwu, and I am a Deputy Director at the Bill and Melinda Gates Foundation, where I lead an initiative called Goalkeepers. Goalkeepers is a catalyst for action towards the realization of the 17 Sustainable Development Goals, and it is composed of leaders who are committed to standing up for the issues they believe in and driving progress on the goals. I am honored to be able to join the Hispanic Leadership Summit virtually this year. Every year, Goalkeepers publishes a report that focuses on recognizing the progress we've made on the global goals and provides a clear view of what needs to be done. But this year, our report was a bit different. We focused on the impact of COVID on the SDGs. Some of the data in the report is discouraging. As of September, when our report was published, extreme poverty had gone up by 7% in just a few months because of COVID-19, ending a 20-year streak of progress. Globally, the pandemic pushed 37 million people below the extreme poverty line. In America, the economic effects of COVID-19 disproportionately impacted people of color. 23% of white Americans said they were not confident they could make rent in August, which is a frightening enough statistic. However, among Black and Latinx Americans, the number was double that. 46% didn't think they could pay for the roof over their head. Economic disempowerment is just one aspect of the multiple ripple effects of this pandemic. And this global crisis, which touches so many different people in so many different ways, requires diverse and nuanced perspectives and solutions. I've been learning about the good work We Are All Human does, and was particularly drawn to its Hispanic sentiment study, which found that 74% of US Hispanics feel they cannot be themselves at work. Now, I do not come from a Latinx background, but as a Nigerian American woman, I know what it is like to have a private and public self, to move between dualized worlds, to exist at the margins of multiple identities and to hold multitudes. But now, more than ever, the world needs humans who understand the complexities of identity and who can highlight those complexities in the spaces they occupy. More than ever, your voice, your lived experience, and your leadership is needed. I hope the summit inspires you, I hope it energizes you, and I hope it propels you and the organizations you represent. Thank you and welcome to this summit.
Every month, the global economy is losing $500 billion due to the ripple effects of COVID-19. By the end of 2021, projections show a cumulative loss of $12 trillion or more. It hasn't been this bad since the end of World War II, a conflict that in part grew out of another infamous global economic crisis, the Great Depression. Almost a century later, the COVID-19 pandemic has created a cascading crisis with impacts far beyond the realm of public health. There's a term for this, mutually exacerbating catastrophes, and it's happening right now on a global scale. So how can the vicious cycle be stopped? Mutually exacerbating catastrophes. It's the idea that disasters end up creating and then cementing crisis after crisis. A pandemic feeds into a recession, feeds into income inequality, feeds into civil unrest, and on and on. A ripple in one sector, in one country, is felt globally, but it is not felt proportionally. Just as COVID-19 has been more lethal to patients with pre-existing conditions, the disease has been disproportionately devastating to lower-income economies and people. And despite their best efforts to respond, limited resources means a more limited effect. For example, 2020 wiped out the sustained economic gains of several low-income African nations, widening the vast wealth gap between high-income countries and low- and middle-income countries. And that, in turn, impacts the response.
G20 countries spent over 20% of GDP in their emergency measures, whereas developing countries spent about 3%. You're already cutting back on what your government's able to do, even at the time you're being asked to do more, and that you're needed even more to sort of mount a response for your people.
The economic and societal ripples from COVID won't fully get addressed without a multilateral response to a singular disease. The pandemic is every country's fight. So global cooperation is paramount. Fighting the virus requires treatment and solid diagnostics in the short term and vaccination in the medium.
We could be living in a world where we're able to get the virus under better control through medical countermeasures. Governments are able to protect their people, and that the temporary problems stay temporary rather than become forever problems.
Think of it as the inverse of mutually exacerbating catastrophes. Empowering public health networks empowers communities, particularly women, which can lead to better outcomes for environmental justice, disenfranchised minorities, and so much more. Yes, COVID-19 can create ripples outside of public health, but the right response to it can have societal ripples that go far beyond the virus. The fight against poverty and disease is measured every year by the Bill and Melinda Gates Foundation in the Goalkeepers Report, but progress has almost entirely regressed. So, the Foundation's 2020 Goalkeepers Report analyzes the damage the pandemic has done and is doing, and advocates for a collaborative response.
I would like to think that we can come back in a way that recognizes the interconnectedness and gives us a blueprint on how we tackle some other global problems in a way that we might not have been able to do before.